Well, it couldn't take any special training though, or do you have, is there such a thing as a trauma specialist, really?
There is. Most general surgeons can do trauma, but you can also go on to do a fellowship, which is another year or two outside of your general surgery training. And, in such, you can, conduct trauma care throughout the nation or even throughout the world. And there's a committee on trauma, mostly organized by the American College of Surgeons, that has to do with monitoring trauma care throughout the nation and the world.
Well, do we have a trauma specialist at Ventura County Medical Center?
We do. We have two other specialists that did training outside of the regular general surgery training. And we have Javier Romero and Stephen Kaminsky, who are both trauma surgeons who went on to do extra training.
How about orthopedics? Anybody special in orthopedics? I mean, that seems like they're involved in trauma somehow.
We do. We have Emily Benson, who's one of our traumatologists, meaning that she specialized in orthopedics, but also went on to do a trauma fellowship in orthopedics. And then we have Dr. Herman, who is a neurosurgeon, and we have Dr. Cassidy, who is also a neurosurgeon. And then we have a slew of other specialties, such as plastic surgery, in addition to oral maxillofacial surgery. And then we have the urologist, we have the intensivist or the ICU specialist, and the pediatricians. We have Dr. Markham, who's a pediatric intensivist, who you know very well.
I think that with Dr. Markham, what we really have looked for with him is all those procedures that need to be done. There's a fine balance there. If you've been hit in the head, you need to be sitting still or laying still in the CAT scanner, and we really want the very best for our children. And bringing a pediatric intensivist with the ability to do conscious sedation is just unique to a county our size and a real blessing for the children here. Well, how about the psychologic impact too? Are there any programs coming out of our mental health program that can help to support the families?
There are some programs involved in which we have either psychologists or psychiatrists to help with post-traumatic stress disorders, which is something very real in any traumatic event. So once the patients are involved in any sort of trauma, we have the appropriate individual involved to help take care of them, either while they're in the hospital or subsequently after they're discharged from the hospital.
So it's not just bones and spleens and the like, there's actually a person attached in there. I think probably the most remarkable post-traumatic stress disorder I saw was a soccer player, and they were almost a professional level, and when they were knocked down to just being an ordinary soccer player, it was devastating to them in a way that we wouldn't think about after trauma. So, and it has long-term problems too, even a month and 6 months and years later. How about our transport system there? How do people come into the hospital? Or is there, what's available for East County and West County?
Well, to be able to be transported to the Ventura County Medical Center, you're either transported by ground, which is a regular ambulance, or by air, which is a helicopter. And we also have individuals that are dropped off by their friends. So we have the back door drop-offs. So we have those three mechanisms of drop-offs.
Well, that sounds about probably one of the more popular ones there. And then the helicopters come out of Sheriff's Department, or so if it always seems like I live out in Ojai that there's a helicopter. It's either paparazzi looking for some movie star, or it seems more likely to be a trauma or a lost hiker or someone who's fallen off a cliff out there.
Right. There's one affiliated with the Ventura County system, and they, for the most part, pick up the patients and transport them wherever they need to go. Occasionally, we have problems with visibility, so they have to be careful about where they land. But so far, we've been fortunate.
You know, that June gloom can be something else, especially when it's year-round. Well, Dr. Duncan, thank you so much for helping us to learn more about trauma. And Ventura, don't get in accidents. We want to prevent them. So I want you to get out there and get moving, but get moving with a helmet on. Let's get.